Hello, everyone, and welcome to Inspiring Hope. I'm your host, Lois Herman, and I'm here to shine the light on people who care, who are making a difference in our world. And if you like more of this content, of this information, please subscribe to our Rumble or YouTube channel. Just find us at loisherman.com. Today, I have a delightful surprise. I have a gentleman that I met several months ago in Hawaii, and we made a connection, and I don't know a whole lot about him. So join me in welcoming Dr. Glen. I'm going to move my pen. Welcome, Dr. Glen Swartwout. And
Yep. In Europe, where it comes from, in the northern part of Holland, Friesland, they would say Swartwout, I think. It's Black Forest,
okay.
so it's a different
Yeah.
Black Forest than the German one, but
Yeah.
I can relate to it. I love the forests.
Yes. Well, and you live in the forest. You have some of the most glorious forests there in Hawaii. So
Yes, the
tell us about
rainforest is
you.
amazing.
Yeah.
But because it's a kind of a complicated last name, you can just call me Dr. Glen.
There we go, Dr. Glen.
Yep, that works.
I can relate to that. My maiden name was Klemaszewski, okay?
Oh my. Yep.
So it's nice and simple, Herman now.
It's simple as sweet.
Yes. Yeah. So Dr. Glen, tell us about you. Who are you? Who is Dr. Glen from Hawaii?
Well, I practiced as an eye doctor. I was actually the southernmost eye doctor in the United States for many years. Here in Hawaii, that's the place to be to do that.
Yeah.
But my first office was actually in Tokyo, Japan, and I worked with my father in New York. He was a pioneer in behavioral optometry, helping people rehabilitate head trauma and stroke and learning disabilities and just learning how to uncross crossed eyes and that sort of thing. So I grew up with that. Actually helped me as a child. I was a C student until he put me through vision therapy, and then I became a straight A student ever since. So without his help from that kind of behavioral eye exercises in optometry, I never would have become a doctor, I'm sure.
Wow.
So really grateful for that. I had underlying health issues that didn't correct, that were the reasons I was having the vision challenges and learning challenges. And so that became really apparent when I was in my last year in optometry school. I was diagnosed with glaucoma, and the ophthalmology professor who diagnosed me took me aside and said, I know, you're the top student they've ever had here, science graduate from Dartmouth, and decided to follow in my father's footsteps. So I was interested in natural medicine, but that's not something that was licensable in New York, where I was from. And it also wasn't something that was a specialty that was acknowledged or accepted in medicine as it is now with integrative medicine. So I knew that I could do some good work and help people because it helped me. I worked as a vision therapist in high school, even saw people's lives change. Yeah. Our vision is so central to who we are, our relationship to the whole rest of the world, all 80% of the brain is directly connected to vision. 2/3 of all of the electricity, the nerve current coming into the brain, is the two optic nerves, which actually aren't even technically nerves. They're tracts of the brain, because the retina is brain tissue embryologically. So it's a whole other world that I've dived into in the field, where I thought I'd be doing exercises with people to improve their vision, and then being able to bring in the nutrition to support that.
Sure.
But when I found out that I was going to be blind in my 40s if I followed the standard of care, the Western medicine, eye drops and some laser surgery, as the professor pointed out, all they can do is maybe slow down the progress, the loss of vision. It's a progressive degenerative condition. They don't really have a good handle on what the cause is, the underlying cause, probably multiple causes, right? Like most things, if it was simple and just one thing caused it, somebody'd figure it out, right? But if it's multifactorial, okay, we don't know, but we can measure the pressure in the eye, and we can manipulate that with eye drops and some surgery. it'll slow down the progress, but you'll be blind. Starting at 25, having lost vision and high pressures, I would have been blind 20 years ago already. So that set me on a path to, like while I was in Japan with a research clinic, I was feverishly collecting all the information I could from Eastern medicine, Western medicine, traditional herbal medicine, nutrition, finding out what can I do? What are the factors that we know of or that have been proposed? What are the theories? What have clinicians tried and practiced and reported? Hey, this seemed to help this condition. I looked at all the blinding eye diseases. The leading one in the world, well, cataract, but they call that reversible because they can do surgery. But I looked at cataract, what's causing that? It's not just aging. My grandmother was 98 when I did her last eye exam, and she had no sign of cataract. And yet the clarity of the lens of the eye is in the top few associations with longevity. You know, when we have aging in the lens of the eye, it's kind of like our joints where there's no circulation directly to the tissue. It's clear tissue. It's avascular, we say in medicine.
Mm-hmm.
So it's even more dependent on the circulation, the nearby circulation, like in the eye or in the joint,
Sure.
for nutrition and detoxification, which is always important for maintaining tissue and cellular health. So I looked at cataract and what we know about that, heavy metals, and that the damage is caused by 2/3 of it by oxidation, which is typically the effects that damage our tissues throughout the body with aging and degeneration. It's always oxidation. And the other third is glycation, so sugar regulation. We know like half of Americans are diabetic or pre-diabetic.
Oh, yeah. Mm-hmm.
Many don't know that also, causes cataract. It causes blindness and many other problems with circulation.
Sure.
Looked at dry eye disease,
Right.
which is very uncomfortable for many people, but people don't realize that worldwide it's considered the leading cause of irreversible blindness, not here in our country because we have adequate nutrition in some ways and a really poor diet in other ways.
Exactly.
But in Africa, there are people who don't get enough protein and they're vitamin A deficient. The vitamin A deficiency is a key thing with dry eye. But if they don't have enough protein at the same time, they don't have enough energy in the liver to change beta carotene, the vegetable source of provitamin A, into the active coenzyme. So even some of the solutions that are being rolled out in the world, like they have a GMO golden rice that makes rice that they can grow in Africa that has beta carotene in it. But it's not supplying the protein they would need. So it's actually kind of a false hope. And we want to give the light of real hope. So we've formed a nonprofit that's dedicated to eventually getting there. And, there's plants that they can plant, like we grow here in Hawaii, katuk. It's from other parts of the world, but it's a great protein vegetable that can solve the protein issue. And then just, a simple capsule of high potency vitamin A. It's fat soluble. It stays in the body. So even that one capsule could make a huge difference for children growing up in Africa. And then there's glaucoma that I had. What we're seeing now with glaucoma with our clients, with 40 years of research into this and clinically putting it into practice, we're now seeing many of our clients with glaucoma who've lost lots of peripheral vision over the past 10, 20 years are able to regain more than half of what they've lost.
That's amazing.
The textbooks, it's incredible. The textbooks still will say it's irreversible loss, even though we see, a couple cases, usually with doctors like me who are doing alternative medicine, implementing other kinds of research that we're seeing on how do we can restore 30% of the circulation that's lost with PEMF, pulsed electromagnetic fields therapy. And that's non-invasive. It's something that you can even do in the home. It doesn't require more doctor's visits. It doesn't need a prescription. And it's great for every part of the body. We lose in 40 years of aging, we lose 30% of our circulation. So by the time somebody's 80, they've lost maybe 60%. If we can bring back 30% of that, even it can
Yeah.
bring them to a level where the eyes will actually regenerate, they'll heal. Again, this goes contrary to what we learn in school. Oh, once there's scar tissue in the brain or in the retina, it doesn't go away. Well, what did you try?
The
Well, we don't
body
have a
is
drug or
amazing. Yeah. The body will regenerate. I used to do ultrasound, and I have actually seen, I've seen with my eyes patients where their liver regenerated post-op, post-surgical excision of part of a liver, and rescan the patient a period of time later, boom, here's part of it back. The body is
yeah,
absolutely
yeah,
amazing,
and
given the right parameters, given the right
exactly,
food, water,
exactly.
energy,
Yeah, it needs what it
sunshine.
needs. And if it
Yeah,
has that, the liver is notorious for regeneration.
yeah,
Literally, there's cases where you can take out 95% of the liver and it can regenerate the full organ.
yeah.
So, we don't regenerate limbs, but salamanders do. And there's research now with like silver, like a layer of silver and the right electrical field and helping to actually get that kind of salamander-like regeneration of our limbs that we don't normally do.
Well, and on our
So look,
skin, we grow new skin. I mean, that's very easy to define,
yeah,
you've got an injury, the body knows how to knit back the cells, the skin cells.
yeah,
So
I like to
you're
say
saying
it's
that the same thing can happen with the cornea and the eye.
and
Wow.
the retina, not the lens. We don't
Right.
see the lens is the densest protein in the body. Think of like cartilage in the joints, but make that and that's like a sponge with lots of water in it. The
Okay.
lens actually has to take the water out to keep it dehydrated, to keep it
Sure.
clear.
Yeah.
And it's also very, very dense. As we age, it keeps making new layers of cells, and these are living cells to keep it clear, yet it's making more and more and compacting the ones on the inside. So it's the furthest physiologically, functionally from the circulation. Very, very hard. So again, very dependent on circulation
So,
and
but a
very,
cat,
you know,
So a cataract, though, is a covering over the lens. So the lens is fine. When they do cataract surgery, they're removing the cover or a cloud over. Can you explain that to me in better terms?
not in most cases, it's actually the lens that's degenerating.
Oh,
Those
it
cells are
is.
losing not
Okay.
enough energy to pump the water out, so they get
Ah,
cloudy because the clarity of the lens, just like the cornea, is clearer as a whole organ tissue than each individual cell. Each individual cell is not so clear, but the body and its intelligence of its design, it layers and arranges them. Like in the cornea, it layers them at 90 degrees from each other. The lens, it's these concentric layers, but it stays clear by keeping out the extra fluid, and it needs energy to pump that out.
mm,
So it's a lot of it, from what I've learned, comes down to what we call terrain, the
okay.
biophysics, which
Yeah.
is even more fundamental. It's the energy, more fundamental than the biochemistry, which is super important.
Right.
And then on top of that, what's important is information like regulation, hormones, and neurotransmitters, and information flow of how the body manages and balances things. And then even on top of that is the information level of consciousness, of meaning, of intention. We
Mm,
know that half of the effect of any intervention, whether it's drugs or surgery, nutrition, is the mindset, which
mhm.
we can actually, if you go into a surgery expecting harm, your consciousness actually is telling your cells to react in a stressful way. If we look at toxins, which is a big problem in our tissues, there's not only physical trauma, but there's toxicity. Half of the toxins in our cells and our tissues are actually from our own stress responses.
I'll bet. Yeah.
It's
And
the neurotransmitters and hormones of stress. So all of those things are super important. And if we want to have the maximum possibility of healing, something that the textbooks say, no, that can't be healed, we have to, what I find, we've got to deal with the whole person, the body, mind, spirit.
and emotions. The body, mind,
Yes,
spirit, and the
absolutely.
emotional body as well.
Right. And
Yes.
emotions are part of the mind. We
Yes.
experience them in the mind, and they also are connected to our organs. In Oriental
Sure.
medicine, they'll tell us, oh, gee, well, where's love? That's in the heart. And where is anger? That's in the liver. And where is worry? Oh, that's in the spleen and pancreas.
Right. Yep.
And what about grief? That's in the lungs and large
Lungs.
intestine. So the five element system for me is a very important
Yeah.
aspect of how we look at, how we interpret what's happening for a person, and how we then ultimately get guidance from the body, because the body is more intelligent than our conscious mind. The people who deal with consciousness and brain function, they'll say that the conscious mind, they calculate, they figure, can process something like 120 bits a second. So it's like a little computer, 120 bits a second, and it's amazing, and it does a great job, and it's
Right.
important. We need to understand. We need to to use that part to affirm what we want with positive affirmations, to visualize what we want. And it's very powerful. Yet the body itself, as a whole, is processing millions of bits a second.
Absolutely.
That's the supercomputer.
That
So
is.
what I learned early on, back in the mid 1980s, I was doing laboratory testing, because I figured, well, that's how do I find out what's going on? Do
Yeah.
laboratory testing. I had a bunch of silver amalgam fillings, so I thought I must have mercury poisoning. Maybe that's part of the problem. So I learned to do trace mineral hair analysis or urine
Mhm.
analysis, blood testing. Mercury didn't show up in the urine or the hair. I later learned from my naturopathic mentor from Canada, who saved my life, that, well, that's because I wasn't healthy and strong and energetic enough for my body to be excreting mercury. It was coming out of the fillings into my body tissues, into my brain, into my eyes, into my pancreas and other places. It wasn't coming out in the hair, which is excretion, getting out of the body. It wasn't coming out in the urine, that's excretion.
Mm.
And so we could test the fillings themselves, and they were off the chart. They were electrical galvanic interaction as a battery effect because of the different metals, which means it's leaking mercury. I had the symptoms, including my high eye pressure and loss of vision. One of the classic findings in glaucoma is breaking blood vessels around the optic nerve. Little tiny bleeds, little strokes, minor, but that's pathognomonic. It's characteristic of glaucoma. But we don't learn in school or in the standard approach that has any possible meaning, that it could be mercury toxicity. But yet that's a classic symptom of mercury toxicity, is broken blood vessels.
Mhm.
What I found out in the European biological medicine that my naturopathic mentor implemented, tested my blood, compared it to hundreds of thousands of people who'd been tested with this test in Europe over the past 80 years or so. And he said, the statistics on your blood is, if it stays the way it is, you're going to be dead within the next 10 years. And I was 30 years old. So I'd be dead
What?
in my 30s of a stroke because of the effects of the mercury breaking blood vessels. And again, that's why I had eye pressures that were very high, and losing vision as well. So when we gradually, little by little, through biological dentistry, removed the source of
Yes.
mercury and replaced it with non-toxic materials, with
Right.
support for mercury detoxification all the way along.
Yeah.
I learned how to do that for myself with electroacupuncture. We could measure at the little electric eyes, the
Yeah.
windows between the body and the skin, where there's neurovascular bundles that penetrate through a layer of fascia that below the skin that acts as an insulating layer, but we have these little acupuncture points that are little windows on the world, and windows to our inner world, where it's like a fractal hologram. Some fun words. It means,
Yeah. Yep.
just
I'm
like
following you.
in ear acupuncture, all the parts of the body show
Yep.
up in the ear. If we look at the brain, we call it the homunculus in different parts, sensory and motor cortex, where the whole body shows up in a pattern there. So that's true on the acupuncture points as well. So learn to be able to monitor those, like electronic biofeedback or biocommunication with the intelligence of the body, and say, well, where are the areas where there's not enough energy? Oh, and what nutrients or herbs will balance that energy? Because
Right.
it'll balance even as soon as you bring the therapeutic substance within the body field, the German studies found within a centimeter, and they'd put in a vacuum to see if there was some kind of material interaction. No, it's a photonic light, electromagnetic, informational sensation the body has of its field out a centimeter. We know the heart field, you can measure the EKG 20, 25 feet away. That's the strongest field in the body. The strongest field in
And
human life.
is that why when if we were to douse something, say we hold up a bottle of supplement or medication, we put it in front of us and we douse, and this is something that I do, is this good for me? And I will move toward it. And if it's not, I'll move away. I have not ingested it. I've not taken it into my body, but my energetic field is sensing whether this is good or not, or then you can even douse the amounts. There's so many people who are using dowsing.
Exactly what I do. For years I did the electronic measurements. I was very electrically sensitive, and then I learned from other mentors. The Omura O-ring is a muscle. It's the only patented muscle test. It's a wonderful fine motor muscle test.
It's patented, is it? I didn't know that.
It's patented, and that's not easy to do with a behavioral type of system. But so that's how we test now, and we'll use test vials in this cabinet over here, hundreds of different samples of different organ tissues, different toxins, foods, different disease tissues, the nutrients, remedies, so we can see what the body reacts to. It is a kind of medical dowsing. And yes, absolutely. You could douse with dowsing rods. You can with muscle testing, like from chiropractic with a stick plate or any smooth surface, run your fingers over.
Or even the arm kinesiology.
Deltoid. Yep.
Yeah, there's some people that I know that do the feet. A lot of the biomagnetic protocol practitioners use the feet muscle testing. It's actually pretty. Pendulums is that type of muscle tension.
Absolutely. When I have a little course on different ways to communicate. That's why I call it biocommunication. There's many languages. Like we have many languages and spoken words, but meaning is the same to the body. The body understands directly the meaning, what this means to it, and we can change that meaning as well. When somebody has a traumatic history, like in I don't know if you've heard of German New Medicine, where it's something that everyone needs to know about. German New Medicine, there's a Dr. Hammer in Germany. He knew he was healthy. He was really on top of his body health. He knew what was going on. And then his son died in a traumatic motorcycle accident. And 6 months later, he had full-blown prostate cancer. And he knew he was not headed for that before this traumatic psycho-emotional experience. So he made a direct connection. He knew there had to be something. And he was looking at MRIs of the brain.
Sure.
And he saw something in his MRI that would be normally overlooked. It's not a disease. They'd say, oh, it's an artifact. It's like a circle, like an area in the brain that's showing something different, like a stressed area. And we're seeing a cross section, so it would really be a sphere. It's an area of stress. When the body has stress or the brain has stress, the calcium goes inside the cells and it triggers stress responses. So like this is an area where there's different pH, there's stress, which is a acidifying thing. Calcium comes in to balance it, but then becomes like a fossil of that stress and continues to create stress in a related part of the body. In this case, that part of his brain with the prostate. And so he started looking back at cases from his past medical history and his practice, and indeed he began to see these things that you wasn't looking for before, but now he sure is. These little circles in the brain. And they'd correlate. People with a circle in this area would have, breast cancer, and people in this area, it would be colon cancer. And so there's a link.
Similar to the ear, different parts of the brain are connected with different parts of our anatomy. Everything is all interconnected in so many different ways. And
so there was always a psycho-emotional stress, and it could be physical trauma as well. I mean, having a car accident has a psycho-emotional impact as
It
well as
sure
the
does.
material.
Absolutely.
And we also know that cancer tends to form where there's scar tissue because there's been trauma in the past. We know that toxins will accumulate there because there's less circulation,
Mhm.
and that makes it lower energy and more susceptible. So there's all these factors. Again, we have to look at all the factors so we don't miss
Yeah.
something that's part of the cause. But what they've shown in large clinical trials now in Germany with this approach, without any radiation, chemotherapy, or surgery, their 5-year survival rates in one study is 80%, and the other cohort is 90%. Now, if we compare that to the standard, trifecta of modern cancer treatment, we're going to do surgery, radiation, and chemotherapy.
Right.
The survival rate is about 2%. Largely, the chemotherapy is very, very toxic.
Mhm.
So that's 2% survival at 5 years with chemotherapy and other standard medical treatment. 80 to 90%, not only survival, but these people are essentially healed. They've
Mhm.
gotten over the cancer, the body's resolved it. There may be a residual smaller tumor of non-cancerous cells that are not growing and not a threat to the body. And you could even remove that surgically without risk if there's no cancer stem cells in there. But if we look at, say, there's a study on breast cancer where they did look at cancer stem cells, and with, again, the standard approach, we know that radiation, chemo, and surgery all are carcinogenic. They're all risk factors for cancer.
Mhm.
That what they found was, while they were able to reduce the size of the tumor, which has always been the measure of success, now that they could measure cancer stem cells, they found that doing the standard therapy, that all of which is carcinogenic, they increased the cancer stem cells 36-fold, which explains why so many of us have seen, friends, family,
Recurrence.
patients
Mhm.
have a good result with standard therapies. Oh, we think we got it all. It's, you're good. And then, down the line, whether it's 6 months or 2 years, or cancer comes
So,
back, and they
so,
say, well, and now it's not going to respond to therapy this time.
so part of it is um, embracing a lifestyle change in order to understand where the original insult and the ongoing insult, like you with the
Yes.
mercury fillings, you had to remove the mercury, the toxin, the
Yep.
original toxin, and then you had to do some other chelation or whatever to remove it from
Yep.
your body and then reset the physiology of the body and reset the mindset. You've got to facilitate full healing. It's a embracing healing and coming into a homeostatic balance on all levels. Is that a correct
Absolutely. And
hypothesis?
if you talk to cancer survivors who've been through, like clinics in Mexico that have a good long-term survival rate, that they will say, actually, the best thing that ever happened in my life was the day that I was diagnosed with cancer,
Right.
because that's when I began to live. I
Mhm.
had to look at, why is this happening, and how can I, if I have a short time left, how am I going to live?
Yep.
So changing the psyche with the German new medicine, they're identifying that trigger, or it could
Mhm.
be an initial trigger and a series that are re-triggering it over time, usually is. And
Sure.
again, the key toxins that are involved,
Yeah.
and how can we heal the tissue. The healing system is the immune system. And for example, chemotherapy generally will drop the immune
Sure
system
it
down to
does. Yeah.
15%. It was already low, or
Right.
we would be in that situation. If it was full, it would already be fighting the cancer.
Right.
But if we drop it to 15% of what it was, now our native innate intelligence of being able to heal that cancer is reduced. A simple thing like uh, taking humic acid will preserve 85% of that,
Mhm.
even in the face of chemo, and it'll heal leaky gut and blood-brain barrier issues and kidney tubule inflammation. And it's a tremendous ingredient. Great research on that. We incorporate it into something we call Terrain Restore, just drops that you take half an hour before each meal, and no more leaky gut reaction. People who have leaky gut, they'll have less leaky gut even if they're exposed to wheat gluten that they'd
Right.
otherwise react
Yeah.
to, or commercial pork that has antibiotics in it,
Mhm.
or vegetables that have glyphosate, that have Roundup residue on because they're not organic.
Right.
So it's just these little solutions that are
Mhm.
from nature,
Yeah. Yeah,
are
and I
so
have my own story from that is back in 2006, I was diagnosed with celiac, and it was again the nurse practitioner who helped me to decide what I was going to do to redirect my physical health. She said most people who are diagnosed with a chronic type of disease live longer, healthier lives because they start to make the changes to embrace health. And that really started me down a path of alkalized water, of eating the
yeah.
periphery, shopping from the periphery of the store. And I
Yes.
now, what is this, 15 years later, I can now eat gluten
Yeah.
because I did
Right.
everything that I could to
Yeah.
detox, to reset, to reshift, removing the mercury from my fillings too. There were so
Yeah.
many different little things that I did that I can't put my finger on. What all of a sudden now I can have a piece of lasagna that I couldn't eat for 12 years, and
Right.
I can have it and no problem. But it's been a series of correct, process improvement for my lifestyle, for my body, for my physical health. So, yeah, we can
And
change it and shift it, but it takes some effort, some conscious effort.
I like to say it's like you learned, oh, I this body didn't come with a user's manual. I have to write it. And now
Right.
you have the manual. So if something is off, you say, okay, I think I know what I need to do. And
That's
if
right.
that doesn't work, then you're going to know that, well, if I research into this, if I, find the right practitioners or the right websites or,
Yep,
the right consciousness, I know I'm gonna find, seek and you'll find, and
exactly
the
right.
truth sets you free.
That's
I want to
exactly
share
right.
a client story, client from Massachusetts who uh, she had had cancer of the blood. It was leukemia, leukemia, yeah, not
Yep.
lymphoma. She had leukemia, and was treated with Western medicine. And she's a holistic practitioner, but
Right.
that's was the only solution she had at the time. And then a few years later, 2 or 3 years later, it came back,
Mm,
and the oncologist tested and said, uh, "I could give you, I could give you chemotherapy, but it won't work because this is recurrent. It's coming
mm,
back. That it never responds. Nothing will work." She said, "Well, I'm gonna do some holistic therapies." And he got mad. He said, and it happens sometimes. Practitioners, they know what they know, and they think that's all there is, and they're mad if you're going outside the box. And he said, no, just you have 6 months to live. Go home. Get your affairs in order. I won't see you again. No need to see you again. Uh, so she found us. We did some great stuff with biofeedback that clears epigenetic patterns that are
sure.
inherited. She did natural remedies for the chemical, physical, herbal, nutritional support that her body specifically wanted, to support the things that the body intelligence knew it had to do first, second, third. So every month for 6 months, and she was feeling pretty good. 6 months later, she thought I should go in and check and see how I'm doing. She did. It got the blood test results back. She goes in the office. She tries to wave to the doctor, and he just looks away. He's still having his trauma reaction, and that she's not dead, and goes in the room, and they send in the nurse practitioner to go over the results with her. She's in 100% remission. And this is a lot of years ago. She's still doing great. In fact, we helped her. Her dog had a tumor in its mouth,
Yeah.
and she healed that.
Well,
Um,
and it is interesting. Most people do not know this, but my husband is just at the tail end of a month long of radiation treatments, and we've been doing holistic treatments with him all along, and it slowed everything down. It slowed everything down. But he decided he still wanted to do this, and the doctor that he was working with, we told him what we were doing, and you know what? I was quite surprised. This is an allopathic oncologist surgeon. an oncologist at the Dana-Farber Center
Yeah.
in Boston, and he said, "Good, because
Good.
all of the things that you're doing is gonna support your system to get your health back
Yeah.
as
Yeah.
we're going through these different things that are going to cause some issues with you, but everything you're doing is going to be extremely supportive." And I was pleased to hear that because so many of the times what your client experienced is what the past that the pattern was is all
Mm.
or nothing, it was an this or that. And I truly believe coming from the allopathic world and fully immersed in the holistic world, I think it needs to be complementary. If you have to have the allopathic treatments, we can you not everybody has some people can sail through the holistic and be
Right.
successful, but others need to have the one, but the holistic between Reiki and magnets and
Mhm.
supplements and all of these other things to support and to reset the body, to also get investigate where does this really come from so that we don't repeat our patterns. So we create new healthy patterns for a revitalized body and in the long run.
Yeah. Yeah. So what we're working on right now
Yeah.
is we've for the past 10 years, 10 years ago, I just realized I'm frustrated with what's available commercially.
Yes.
Like I found the research on French lilac, which is actually what they make metformin out of as a
Okay.
drug. About a
Yeah.
third of drugs are made from herbs. They
Yes.
don't tell you that, but and they recently found that metformin has carcinogenic
Mm,
toxins in it. They didn't
yeah.
realize, like, oh
So
dear.
many.
And it's also a drug dosage. It's a high dosage, which has its toxicity. Natural things do. Um, so I looked and I could only find one supplement on the market that had French lilac in it. And it had other things that I didn't want. It was in a tablet form, which comes with a lot of magnesium stearate to bind it together. Well, that forms a biofilm on the gut and on the
Sure.
nutrients. You're not absorbing your nutrition from your food as well. It's like,
Mhm.
that's no, I
Yeah.
need to formulate my own products. And so we just started buying all the most concentrated, most bioavailable, best forms. I wasn't concerned about what's the price of the product going to be. It's not a commercial thing. It's about what's going to actually get the healing. And
Right.
I know from my work with the biofeedback, the electronics, and muscle testing, working with clients remotely, tuning into them, using my body as a surrogate to feel what their
Sure.
body will respond to, that different people need different things.
That's right.
So we'll have 24 or 36 ingredients in many of the formulas for whatever it is, sugar regulation or macular degeneration is the thing that we're now focusing on in terms of bringing out these formulations that we know have been working beyond what we've seen before that, even with individualized therapy, uh, bring those out onto the commercial market so that all the holistic eye doctors, all their patients can get access to them. The public who's doing self-healing will have
Yeah.
access to the formulations. Because we're seeing 100% right now, 100% of our clients with both wet and dry macular degeneration. So obviously a lot easier with the early stages.
Sure.
Although in the conventional setting, they've found with the research with the ARIDS, the standard supplement, that it doesn't have any benefit in the early stages. So they don't have anything that you can do to help the early stages of going blind. It's like, does that make sense? We see results, actual, not just slowing or stopping the progression of vision loss, which is
Sure.
the best that you generally hear from standard medicine, is we can slow down the progression with
Right.
with needles in your eye once a month. Well, that most people don't really want to go there.
Oh,
Uh, Although, if it's a choice of that or blindness, and 40% of the people who get those injections may wind up with worse vision than they would have without. So it's a kind of worse
now you're
than,
you're talking about glaucoma. Now that's different
well,
than
no, that's macular
macular
degeneration. Yeah.
degeneration. There are a lot of people that I know that are coming of age that have cataracts. What do you can you help to reverse cataracts?
in some cases, especially again, the earlier stages are a lot
Okay.
easier than the
Mhm.
later stages because it's degenerative. And how do you,
Okay.
if there's more damage, there may be cells that are dead that don't come
Sure.
back in a
Okay.
tissue like that that's not regenerative.
Okay.
Uh, but yes, we've certainly, I mean, I've over the years had many people who, even despite like a young girl, my former business partner, we had a nutritional business that we formed together. His daughter had lupus
Mm.
from a very young age, very serious lupus, and they had her on high levels of steroids, which cause cataract. Even topical steroids can cause cataract and glaucoma.
Really?
Um, and so we actually found that we had to work in between tests, medical tests, because they base their dosage on the level of inflammation. And when
Sure.
we stimulate detoxification, there's going to be increased inflammation. When we're working with regeneration,
Okay.
with regeneration, there's going to be less inflammation. So we'd have to not be doing detoxification during those sessions, so they wouldn't give her too high a dose of steroids. But over like a 10-year period, her vision, despite the steroids and having cataract, the vision improved
Wow. Wow.
multiple lines.
Okay.
So um,
So
we
how do you treat people? I mean, you're in Hawaii. I would love to come to Hawaii to see you and be treated. However, it's probably not as practical as, do you actually do telemedicine or Zoom-based
yeah
sessions?
yeah. So the testing itself, we don't do. We're just looking at possibly bringing back in a few laboratory tests in some cases where we want that information, or to monitor. Like there's tests now for aging where we can do some
Mhm.
studies and see how much reverse aging, because we tend to get a year reverse aging with 1 month of a focused program.
Okay.
That's what happened with me. In 3 years, I brought my biological age from about what it is now, about 68, down to what it was, my chronological age, actual age was at that time of 33. In 3 years, like 36 years of reverse aging of
Wow.
my system, and averted dying of a stroke, and averted the blindness
That's
that I was headed
amazing.
toward. So
Wow.
we have several different tests. The main one I rely on is myself as
Kinesiology.
a
Yeah.
medical empath with
Yeah.
surrogate kinesiology, with the Vega test protocol of hundreds of little test vials, glass ampules that have these different energy samples. And I can feel it. And we say, oh, what is it that's reacting? Okay, identify it. And people will say so often, like, oh, what you found there, I didn't even tell you about that. Oh, it's like they forgot to put it on the history form. It's, or when we're dealing with the psycho-emotionalists,
Sure.
amazing with flower essences and gem essences, and it'll be like, that's that pattern that they didn't tell us about is like, that's so exactly what's happening in my life right now, and such an important part of the healing. And then we'll put that in a base of that terrain restorer that I described, that reduces inflammation throughout the body, heals leaky gut, heals the leaky blood-brain barrier. There's been children with that were nonverbal, that in 24 hours, because of the effect on the blood-brain barrier, they
Sure.
were able to start speaking.
Wow.
There's
That's
just
amazing.
so much healing is
Yeah.
possible.
No, I'm very familiar with floral essences, but that was new. You mentioned gem
Gem,
essences.
gem elixirs, yep.
That's fascinating, and it makes sense. So it's elixirs from the different gemstones, from the
Yep,
different.
yep. Even also we're adding. There's a really neat company out of Germany that's expanding that range. We have now animal essences, planetary
Oh
essences,
my
and
goodness
no planets were
gracious.
injured in the making of the essences with the flowers and
Well, that's
animals.
like I have my kitty therapy, I've been
Oh,
missing my
yeah.
kitties from being gone, and just was like, I need my purr therapy because the cats give that energy essence of
And
calm.
oh, that is so backed up by research that the
Yes.
vibration of a cat's purr is very healing to humans. So yes,
Mhm.
encourage everyone to get
Yes.
the cat, and it's therapeutic for the cat too if they're purring.
Yeah.
They're loving it.
That is so
Yeah,
awesome. So, you will give me information as to how people can get a hold of you? Um,
sure.
and
Yeah,
because
one really great starting point. I've got over 50 websites, and they're
oh,
all linked. They're all free. They're all linked from my personal website, glenswartout.com. So that's a
Okay.
great starting point. But I think even better, I've just formed an online community. It's free to
Okay.
join. We have free courses there, and that links out to the other websites. So if on a certain topic, if you want to learn about stearates and supplements and why you want to avoid them, and they're in 80% of our supplements, or phthalates that are in most drugs that are enteric or enteric supplements, and they destroy the immune system because it's plastic, and the average
Right.
person is eating the equivalent of a credit card a week of microplastics. We're using special glass bottles that are violet glass. It lets in ultraviolet and violet light. Talk about light and hope.
Right.
And infrared, because the infrared keeps the nutrients energized and active, so they'll be
Oh,
more effective. And the violet and ultraviolet prevents the growth of bacteria and fungi that would break down the
oh,
nutrient. Things just last longer and stay higher energy.
nice.
Those glass bottles. So don't throw them. If you get any from us, don't throw them away. At least donate them to the local charity, and people will buy them to put the herbs in to keep them longer, or things like
Okay.
that.
Yeah.
But then, so the community website, I have a short link for it. It's at truly.vip/ASH. Stands for Accelerated Self-Healing, which is the umbrella for our approach. Truly VIP ASH. The direct link is as simple as school.com/heal.
Okay.
All
So
heal
I'll,
is,
I'll have you email it to me or
I will,
text it to me, and I will put it in the
in the note.
information
Yeah.
on our recording. That is so awesome. Well, I'm
Yeah.
looking forward. I'm gonna have to reach out to you because I have been told by my ophthalmologist that I've got the beginnings of a cataract. So this is time. This is when, if you before it goes into the full blown, this is
Yes.
now is when you've got to shift whatever it is that I'm
Yep.
doing, be it interacting with the computer all the time, which creates dry eye, which there's so many different reasons I'm sure that you would be able to share with me as to what's causing
Absolutely.
this
And
sort of stuff.
any additional information you can get from your eye doctor is helpful. Like, you're pretty young, right? So you're pretty young for
You're so
starting.
awesome. I am your age. I turn
Okay, well,
69 in a week. So
okay. Well, you look like you're in your 50s.
thank
If you were
you.
in your 50s, I'd say maybe it's posterior subcapsular cataract, which fits the description that you gave me of cataract, of a
Okay,
film. That's a film on the back of the eye
I see.
that's very different causes than other types of cataract. It's more related to immune function, adrenal and immune
See, I've
balance.
had adrenal and problems like that in the past. So,
Yeah,
okay,
yeah. So that's likely what it is. We have a special formula for that. So instead
okay.
of, here's our eye formula, because
Yeah,
we
yeah,
deal so
yeah,
much with eyes. We have formulas for every issue and part of the body that our
yeah,
clients have. It's like somebody's got, GERD. Okay, so I have GERD guard, and it's
yeah,
great. It has
sure.
all the different herbs. Sometimes this one works better. Sometimes that one works better.
Yeah.
Uh, or like migraine, there's a couple of different, there's a combination of herbs that works great, another herb that works great, but it's usually mercury toxicity. So we support the mercury cleansing and the herbs that reduce the symptoms. And it just works better to have as concentrated a source as possible, as clean as possible, and as comprehensive,
Mhm.
because each of those, like the energy the body responds to, that's
Sure.
our healing response. If we're triggering those healing responses for all the different possible remedies, it's kind of like complex homeopathy, where
Mhm.
around the turn of the 20th century, they found Requig in Germany said, in the clinic, we don't have time to take a 2-hour case history of each person for this, in the acute treatment
Sure.
clinic. Can't do it. But if we put in these 12 homeopathics that work together, it's going to cover all of those, and the person won't have any bad reaction because they're non-toxic to the ones they don't need, but they'll have the healing response to the one they do need.
Mhm. Sure. That's awesome. Wow.
Yeah, looking forward to playing
Yeah.
together. Yeah,
Yes. And so
yeah,
you have managed to, in the process of healing yourself, discovered ways of healing others. That's the true
yeah.
path of what is called the wounded healer. And I love it. It's wonderful. So in your own way, you've discovered how to get new sight, new vision. Yeah.
Yeah, we're
That's
on a mission
beautiful.
to prevent blindness,
Prevent
especially
blindness.
right at first macular degeneration. It's the leading cause of irreversible blindness in our culture.
Wow.
And we have some new solutions that are much more specific. We've got
Yeah,
a whole handful of remedies just for macular degeneration to
that's
solve
amazing.
the problems that are out there. Like most of the supplements, the eye supplements will have mixed carotenoids, because we know these different carotenoids are concentrated in the macula of the eye and are protective. We need them. But when you put them all together at one time, and there's only one channel for absorption, you're only going to absorb one and not the other. They compete. So we put them in separate formulas with all of the other synergists that help
And
the
you're
eye.
right. If even if you're taking in the right supplement, if your body's not absorbing it, or if you're doing things that are causing it to not be absorbed, it's not going to be as effective. So there's multifaceted, I'm sure. Yeah.
And we need to absorb it. Now we need to deliver it to the eye or the brain. Eye, again, the retina is part of the
Okay.
brain
Yeah.
embryologically. So I've just increased it from 7 to 10 different factors we've identified that will help with that increase the delivery. So little bits of those, it only takes up, maybe 7% of the whole capsule, but it's enough that love to do when we have the money to do the research.
Sure.
How much does that increase the cellular delivery? Ginkgo, for example, increases circulation of the eyes. Niacin, not enough to cause a flush and discomfort. We had to actually back off on the amount in our bioavailability blend that we put in so many of the formulations to get it where it needs to go, especially to eye and brain that have that blood-brain barrier, blood-retinal barrier.
Now, do you specialize in eyes, or do you help? What type of? Because I can think of a couple of different people I would refer to you specifically because of eye situations. But are there other types of treatments that you work with, or other types of issues that people have that that is your specialty?
My specialty is solving the mysteries of healing, of really retracing, of working with your body's own priorities. What is it your body wants to heal? Somebody maybe has, a serious blinding eye disease, and our first test, we might find your body's not even talking about that. It happens all the time with cancer. Person has just diagnosed with cancer, you test, their body's not talking about the cancer. If the immune system was strong enough and had cleared other issues that they've piled up over the years, then down to that core issue, it'll get there. But we have to clear, to my thinking at this point, the way to get there is to, yes, we can start by knowing the clinical, we know their diagnosis. They have macular degeneration, they have cancer, whatever it is. We know here's something you really should be on, because that's going to be helpful. It's going to be more helpful once we clear all these other issues. That was where your body's energy, your healing is going.
Right.
We're going to see what does it need to clear all that. It'll take about a month to clear that out, and it's going to go to the next layer and the next layer. And eventually we'll see when somebody comes in and their main chief complaint is at the top of the list energetically for the body, I compliment them on the healing that they've been doing. And
Right.
they always say, yeah, I've really been researching and finding practitioners, and I'm doing this and this and this. I have my PEMF met, I'm drinking my alkaline ionized water.
That's
I was
right.
like, oh, you got two of the most powerful healers right there in your home. You
That's
don't
right.
have to pay for,
Mhm.
time in a clinic. You don't have to travel and set an appointment and all of that.
Yeah.
Yeah.
Yeah. Well, Dr. Glenn, this was fabulous. Thank you so much for the work you're doing and for sharing and for being here. And how was everything in Hawaii? I was so concerned about, I love, I've been to all but one state. I have yet to be to Alaska, and I want to go when the Northern Lights are the most glorious. At some point I
Yes.
will. But I've been to Hawaii twice, and I loved Maui, and it really hurt my heart with all of the devastation that happened there. How are the people faring, really? Do
Well,
you?
it's a different island, so we don't have
Yeah,
a lot of contact. We have some clients on Maui, but
yeah,
fortunately not in
yeah.
Lahaina. Uh, it's I think it's symptomatic of the confused state of our planet right now. But
Yeah.
I know we're going to get through this healing
Yes,
crisis.
we are.
It feels the worst when you're healing the fastest. We
Yes.
will get there. Trust and pray for healing for all of us. Yeah.
We are on the same wavelength with that. Absolutely. Keep praying. We've got to
Yep.
keep and then the Hawaiians have that natural, that's part of what their whole aloha is the power of prayer, of acknowledging the essence of energy in everything. So
Yeah, they talk about ho'oponopono. To
right.
pono is correct, making things correct, balancing, getting everything just balanced, and what I call syntropy, the opposite of entropy,
Yeah.
which you can measure with like temperature is entropy, but syntropy is like biological systems or crystals, or the universe is structured and organized intelligently. We're learning so much more about that, about the electric universe hypothesis, and
Yeah.
we're dealing with the body electric
Yeah.
energy. Without energy, your cell can't do anything. How can we
Right.
restore lost vision and glaucoma? The cells are there, but they're not functioning visually. You get the energy function up, what we call the terrain, rejuvenate, and regenerate, cleanse, and balance the system. So learn lots more about it in the community site, and
I
it's
will,
interactive. We have
definitely.
open office hours, so we can talk more with
Beautiful.
people who are
Thank
interested.
you. Very much so. Meanwhile, I'm going to do a little bit more Reiki to get some energy going to my eyes.
Yes. Yeah.
Right?
Very, very, very helpful, very
Yeah.
powerful energy.
Yes.
Warm up the
Exactly.
palms and
Yeah, that's
yep,
right.
yep. Not pressing on the eyes, but
No,
just like
yeah,
eyes open or closed, but
just
not pressing on
putting
them.
that beautiful energy in there. Yeah.
And when you do that, you'll probably see some light in your visual field when you first do it, and then the light's so clear, like the after image of the lights in the room.
Yes.
And if there's stress in the eyes, that may not go totally black, but with doing that practice, you'll start to be able to see black after a couple minutes of like dark adaptation.
Mm.
It's a great,
Wonderful. Well, so
great
much to
practice.
learn and so much to share.
So much fun
It
to be had, and
is.
the
It
results
is.
are so worth it.
Yeah. Wonderful.
Yeah,
Well, thank you for your passion. Thank you for the work you're doing.
yeah, thank
So
you. It's a real
I
pleasure.
honor you.
Many,
Blessings.
many
Very many
blessings to everyone
blessings.
out there.
Yeah. Aloha.
Aloha, indeed.
Bye-bye for now.
Bye.